with that, I'm going to introduce our topic of how to manage CLL-associated fatigue. I'm going to introduce our speaker, Allyson Armstrong. Ally is a physical therapist who grew up in Colorado and moved to Utah to complete her doctorate in physical therapy from the University of Utah. She focuses on acute care and has dedicated much of her career to working with patients in the intensive care unit, and is further specialized as a board-certified geriatric physical therapist. Currently, Ally serves as an acute physical therapist at the Salt Lake City VA, where she is committed to helping individuals of all ages achieve their highest level of functional independence. Outside of her professional life, Ally enjoys snowboarding and biking with her husband and their dog Magic. And with that, the floor is yours, Ally. Let me switch over to your slides.
Dalton, that was such a nice intro. Thank you so much.
You're welcome, and thank you for joining us today.
Yeah, so I'm going to be talking about physical activity for patients with CLL. That's all of you here. I can see that there's 18 of you here, so I'm really excited to meet with you and answer any questions. This is going to be a pretty interactive presentation, and so as we go on, you could put any questions that you have in the chat, and then I'll make sure to go over them at the end. If you can go ahead and go to the next slide. So today we'll be covering the difference between physical activity and exercise. And if you think you're going to attend a lecture with a physical therapist without moving, then you came to the wrong lecture. I am going to challenge all of you to do a stand. So you're going to stand up from your chair anytime I say physical activity. And I want you to do a desk push-up, which is where you just push up from your chair anytime I say exercise. That way you're getting a little bit of activity in while we're doing this presentation. I hope that by the end of this presentation, you'll have a good idea about how to do physical activity safely, the benefits of it. We'll talk about pain management with physical activity, fatigue management, go over some resources, and then your questions, of course. All right, so this is where you have to start doing sit-to-stands, so standing up and sitting down, and also those chair push-ups. I'll be watching you. I can see some of you live. In this, we're going to go over exercise versus physical activity. And there's going to be a pop quiz at the end of this. I'm warning you now. So with exercise, it's structured, it's planned, it's repetitive. I think we all think of exercise as this thing that we have to do, something on our checklist. Maybe it's scheduled in our calendar. I think when you picture exercise, you think of a really smelly, poorly lit gym that maybe you've been paying a membership to but never go to. That is exercise. And exercise is great. It can be a way to physically exert yourself, and it can be moderate or vigorous. Physical activity is just a broader term that exercise falls under, and it's anything that is above rest. So if you're doing stands and sitting down during this presentation, you're doing physical activity. If you're doing a chair push-up during this presentation, you're doing physical activity. So it's any movement that requires energy. It could be gardening or housework. It could be playing with your kids or grandkids. It could be playing with your dog or walking your dog. So that's physical activity. So you guys can put your answers in the little chat, or you can unmute and yell it out. This should be really fun. But I'm going to show you a series of slides, and I want you guys to tell me if you think that this is physical activity or if you think this is exercise. I'm going to open up the chat so I could see some of them.
Physical activity.
Yeah, I agree. Whoever said physical activity, you were right. This is more like vacuuming. It's not repetitive. It's not structured. We're doing it because we have to. Maybe a wife's job, maybe a husband's job too, depending on who's in the house. But yeah, great. We could go to the next slide. Okay,
Neither.
person. Yeah, this isn't either of those things. It's not anything above rest. It's not structured. So yeah, this person is not doing either of them.
Exercise.
Yeah, this is repetitive. It's scheduled. I think this is what one of the main things we think of when we think of exercise.
Physical activity.
Yeah, this is more physical activity, but it could also be exercise. If you've planned it and you're like, I'm doing this to get my heart rate up, I'm going to go up and down the stairs a bunch of times because maybe I don't have a gym membership. So I think this could be either depending on the repetition of it.
Exercise.
Right. This is a little bit more planned. Maybe you're doing it with a trainer or a physical therapist, and it's a very purposeful, vigorous, repetitive movement. Okay, you guys passed the quiz. Wonderful. I hope that you can take away from that we don't have to label something as exercise to get benefits from it. There's so many benefits from physical activity in general, and we're going to talk a lot about what that might look like in your day-to-day. And we're going to start with a little talk about safety. So a lot of times before you start an exercise program or like maybe you go to a gym, they'll be like, consult with your physician to make sure you're safe to start this physical exercise program. And we can go ahead and go to the next slide. However, like really, if you're doing physical activity versus exercise, you really can start with your own home. This might be something really low and slow, like my little turtle on the slide. This might be, I usually go to the mailbox once a day. Can I do this 3 times today? And those are just steps that you're accruing in your day. It might be a walk in your house. I have a lot of patients that will be like, I can do 1 lap around my house, but I'm going to try and do 5 in one day, or maybe 2 at a time. That's an example of titrating your physical activity up just a little bit at a time. You really need, when you're thinking about physical activity, to be more concerned about your environment. So if you're in a cold climate, I'm here in Utah where we have snow and ice in the winter, you might need specialty footwear when you go out to do your physical activity. You might need a jacket, you might need gloves, or you might skip the physical activity outside on those cold, snowy days and go to Home Depot or Walmart and walk around where the environment can be a little bit more secure. You want to avoid poorly lit areas. So if you know that your sidewalks don't have good lighting, or maybe your Walmart and Home Depot forgot to pay their power bill, don't go there. You want to see where you're going and what you're doing and be safe with that. And then another consideration, of course, is your immune system. So perhaps you're concerned about your immunity after cancer treatment, and you need to maybe avoid a crowded place like Home Depot or Walmart and scale it back and do more things in your own home. And that's okay too. You also might consider wearing a mask to protect yourself and be aware of your immunity. So those are just some safety considerations. I think many people also live in very hot environments. And so you might have to consider the time of day that you go out and exercise, wearing sunscreen and a hat, go in the morning versus midday. So consider your environment before you start any kind of increasing your physical activity. And of course, we really want you to monitor your symptoms. I work with veterans, and they are the most wonderful people, but they have been trained to not listen to their body. They go to boot camp and they have to just train really hard and go until they feel like they're going to pass out. Now, as adults, outside of maybe boot camp, you don't have to do that anymore. You really need to monitor your symptoms and be honest with how you're feeling. So if you went from walking 1 time in your house and you're increasing it to 2 laps, and you notice halfway through that lap, I feel a little dizzy or lightheaded or short of breath, or especially chest pain, you definitely need to like stop and see if that improves. And if it doesn't, then that's when you would need to consult with your physician. So physical activity can be very safe, especially if you consider how you titrate and increase it, consider your environment, and then also monitor your symptoms. We can go to the next slide. Nice. So I just love this picture of a dog. Dalton knows I'm a dog lover, and I wonder if any of you are out there as well. And I think we've all seen the joy that dogs have from doing physical activity. They don't really care what you're doing with them. You're just like, okay, let's go for a walk. You grab the leash and they're like, I'm in. Like, great. Or you might even just like go out in the backyard and they're like, cool, I'm going to follow you out here or follow you all over your house. And they're just really happy to do that movement. So I like to think about all the benefits of movement when I see this happy dog. So if we go to the next one, we're going to talk a little bit about some of the things we don't think of when we think about physical activity. I think everyone is conditioned to think, oh, I need to do physical activity to lose weight, or I need to do physical activity to improve my fitness. And those things can be true, but there's so many more benefits, especially as a patient with CLL, that you might gain from starting to increase your physical activity throughout the day. The big one that I think is a surprise to a lot of people is this pain management. And you all know, as a physical therapist, I see a lot of people for pain. And a lot of times what will happen is people will have pain and then they'll decide to back off on their physical activity, and then they'll get really stiff, and then that will increase their pain. And then they'll also start to think about fearing that pain, and they get in this spiral of not moving at all. And so a lot of times, if we can titrate that physical activity a little bit to be just moving around, maybe even it's just standing up once every hour, then we might be able to mitigate some of that pain from not moving enough. We know that joints are meant to move, and when we move them, they actually lubricate, and that can decrease kind of osteoarthritis pain. We know that our muscles get really stiff and shortened when we like sit for a long time. And so getting up and just even standing up and getting in a more extended position can help with the muscle pain too. So pain management is one of my favorite things to go over with patients, of like, hey, if we do a little bit, we might be able to alleviate some of this pain. It's great to strengthen your immune system. So exercising and physical activity has been shown to increase your immune response and make it a little bit more robust. Of course, if you're in the middle of your cancer treatment, that might be very difficult to do, but something that you're something to consider if you're done with that treatment. We've all heard about the benefits of our mental health, so our emotions. So we might notice, like, waking up first thing in the morning, we don't want to get out of bed, we're feeling a little tired, maybe we're feeling a little sore, but just taking a little walk to the mailbox, enjoying a little bit of sunshine, getting a new perspective can really help with that kind of mental fatigue that can be going on when you're going through cancer treatment or even recovering from it. And also when you start to see those improvements of, okay, I went from being able to just do 1 lap around my house a day to 5, you start to get like a little excited for yourself. Like, what else can I maybe do that I just need to start to practice a little bit. So increased mood might also lead to more activity, because if you feel good, you might also have a little bit more energy. And then, of course, if you're going through any kind of chemo or radiation treatment, you might be noticing that you don't have your normal appetite. I have a lot of patients who tell me that food doesn't taste as good as it once did. So when you do a little physical activity, it could increase your appetite because you're burning more energy off and your body's requiring more of that. So that can be an added benefit. A lot of times that weight loss that happens during treatment ends up being muscle loss, not fat loss. And so if we can curb that a little bit with good nutrition, that's great. And then that increased appetite might also lead to better energy throughout the day. And then who doesn't need better sleep? I don't know about you guys, but that's like always my number one goal is getting better sleep. So some people need to exercise right before they go to bed to get a good night's sleep. Some people that really amps them up. And so they don't feel like that's beneficial to them. They're better if they exercise or do their physical activities in the morning. Some people need to do a little bit throughout the day for that better sleep benefit. But if we do a little bit more physical activity throughout the day, it might help reset our circadian rhythms. And I think we all love to hear that, especially when it's not really expensive or fancy like melatonin pill or something like that. Okay, we can go to the next slide. I hope we're all amped on physical activity because it's so good for us. So now we're going to talk about fatigue management. And this is real. So when I have patients that are in the hospital and they're post-treatment or even during treatment, a lot of times the hardest part is just getting over that hump of first getting up and moving. And that's where we'll talk about how to manage that throughout the day. If we can go to the next slide. A lot of times we just have to initiate. So if you're like, start a routine of like, okay, every morning I need to get up and just like get down the stairs. And that's how I'm going to start kind of combating that fatigue. Doing that little bit of movement can kind of start to stimulate blood flow in your body, start to stimulate an appetite, which would lead for you to like maybe cook a meal, which is also a physical activity. Maybe you recognize then you need to take your shower and get dressed. That also is a physical activity. So just starting with a little something in the morning, like a ritual, that could be really helpful. I have some patients who, when I first come to see them and they're in the hospital, they won't want to get out of bed. And I'll just say, let's just try and sit on the edge of the bed and see how that goes. And usually once we do that, then we can get to a chair. And then later I can come back and we can maybe do a little walk. In your own home, that might be something like, I look forward to my cup of coffee every day. I'm going to make sure I have to get up to get it so I can initiate some physical activity first thing in the morning. With fatigue, I like to think about having a budget. And depending on how much sleep and my total week's activity, I have maybe a full bank account for the day or maybe a diminished bank account. So in this, kind of fake world where every morning we wake up with a full bank account, we have all the energy in the world and we can do whatever we need to for that day because we have our bank is full. By the end of the day, we've used most of it. We have a good night's sleep. Again, we wake up and our bank is replenished. But that's not real life. Like real life is, I slept really cruddy last night. My bank isn't full today. When you wake up on one of those days, while it's still important to initiate some physical activity, you might decide to take some of the physical activity off your list. Maybe instead of showering every day, you shower every other day, knowing that that's going to take a lot of your budget for the day. A lot of my patients say showering is actually one of the most fatiguing things that they do in their activities of daily living, and that it just wipes them out. So if that is the case and you're on a low budget day, don't do it that day if you can help it, or plan that that will be the thing that you do. And that's the one physical activity that you do. What you might also do is use your cash wisely. So look for really high value items. So I like to think about, okay, I really enjoy gardening and I want to get out and garden today, but I didn't sleep really well last night. So I'm going to go out and maybe break up my garden into eighths. I'm going to pick the weeds in this eighth of my garden and then I'm going to go rest. If I have more energy later, then maybe I can shower or maybe not. but it's kind of like taking those big tasks, breaking them up, or spending them on the things that matter most to you. Maybe you have a big family event coming up and your grandkids want you to go to their birthday party at a trampoline park, and it's going to burn all your budget in one day. And you plan for that all week, knowing that's going to be your big outing. Sometimes you might need to modify some of your physical activities to accommodate your budget. I like to use a car analogy for this. So if you were driving on the highway and you had an empty tank of gas, are you guys going to drive 90 miles per hour or 60 miles per hour to get to the nearest gas station? And I might have lost some of you, but I'll wait. So if you're trying to make sure that you get the best economy for your gas on the highway and you're driving to a gas station, your gas tank's almost on empty, you're going to go 90 or 60?
60.
Yeah, you're going to like conserve some of that energy. You're not going to pedal it to the metal to the nearest gas station. And it could be same with physical activity too. So if you're like, you know what, showering is a big activity for me to do, I always feel wiped out with it. Maybe I need to sit to do this instead of stand. I love gardening. It's a really high value physical activity that I enjoy and I want to make sure I keep doing. Maybe I need to get a bench so I could sit and do it for longer. So it's kind of spreading out those energy bucks a little bit more throughout the day. Sometimes getting a little rest in between can help fill your energy bank so you can do a little bit later in the day too. So yeah, that's my budget analogy and my car analogy. And with that, sometimes you do have to modify. So that's where you might see some people using shower benches. Four-wheeled walkers can be really nice. So you could sit down and take a rest on your walk. Shopping carts at the grocery store are awesome because you can get a lot of steps in at the grocery store in a safe environment. But pushing that cart actually can help make those steps a little bit easier. Sitting to garden is another good one. Maybe you were a runner, but now you're going to be a cyclist because then you can sit on a bike versus being standing. So if you want to talk about some of the ways to modify your activities or your exercise, we'll have some time at the end of this presentation for that. Okay, we'll go to the next one. Nice. So I think that this can be really overwhelming to start increasing your physical activity or changing your exercise routine. And it's really important to know what works and have some resources. So, of course, as a physical therapist, I'm going to say if you have any like very specific medical conditions, aches or pains, or if you're starting an activity and you just don't think it's going very well, go seek out a local physical therapist. Evidence has shown that we're more likely to stay with our physical activity if we do it with a friend or a community member, or if someone's there to like hold us accountable. Maybe it's a spouse or a partner. Maybe it's like a group of guys that just always happen to be at the senior center at the same time. That's where those resources can be really helpful to keep you accountable and also help you progress. So a lot of senior centers or rec centers will have silver sneakers or group fitness classes that can be accessible or even free. So I know here in Utah, we have Salt Lake County Aging. They have a lot of great free resources for starting exercise programs. And then some hospital systems too will have free resources for you to start to exercise with in conjunction with your cancer treatment. And those can be really great if you go to your local hospital's website. I pulled up some of ours here, and almost all of them had physical activity resources for patients in cancer treatment. So know that those are out there and you don't have to do this alone because that feels sometimes insurmountable. And also we know, find a buddy because you'll probably stick with it. Very nice. So I wanted to leave a lot of time for questions for everyone because I think there are a lot of specifics to your everyday life, especially when it comes to like pain management or maybe modifying a physical activity. And then also, this is your group here. Like, I don't know if many of you know each other, but you might be able to be like, oh, yeah, I had a really hard time walking, and this is something that helped me be able to go a little farther when I did it this way. Because you all have firsthand experience of living with your CLL. And of course, if you think you broke the record for the most sit to stands or chair push-ups during a presentation, I need to know that.
Awesome. Thank you for your presentation. That was great. And I even feel like I learned a whole lot about managing activity, and I try to stay fairly active myself. So that was awesome. Like Ali said, now is the time of our presentation that we have open for discussion. So if you have any questions, feel free to unmute yourself or drop those questions in the chat, and Ali can answer them for you. We have this time set aside specifically for this, and we want it to be as engaging and useful for you as possible. So feel free to throw whatever in there that you need to. And we understand if you need to hop off prior to the completion of our Q&A session. These resources will be made available for you after the event. We'll post them about 48 hours after, and you will still have access to the post-event survey when you leave. So if you have recommendations for things you'd like to see in the future, or comments for myself or the HealthTree team, feel free to fill that out and we'll do our best. But with that, it looks like we have one comment already.
Oh, great.
This comes from Betsy. What foods do you recommend on those days when fatigue is a real problem?
Betsy, that's a great question. I think that you're going to look for energy dense foods, especially if eating seems like more of a chore. Sometimes you also have to just go for anything that's going to be something that you could get down. Some of my patients are like, ugh, I just can't have this salad, but I can have this roll with like a little butter. So if you're to the point where it's just like, I have to find something that I can eat, then go with that. If it's a day where nausea is not as much of an issue, then go with something like a hearty salad, a sandwich with like some really good protein and like veggies on it. Those things are going to replenish your energy bucket a lot better than like chips. And one of the reasons why that happens is because when you eat things that are less dense in nutrition, so like potato chips, that's like the perfect example, it gives you a sugar spike. So you have this initial, oh, I feel a little bit better, but your body can actually burn through that pretty quickly. And then in like a little bit of time, you're going to be right back to where you were before. Versus if you have something that's more energy rich, like, a green leafy salad with like peppers and tomatoes and like a really good dressing and maybe like, hard-boiled eggs or like a little bit of protein with some nuts on it, it's going to like not have you get that really high spike and kind of last you a little bit longer. Does anyone else on here have any other like snacks or like favorite meals that you've seen that have helped you? Smoothies are another really big one that some of my patients love, or like protein shakes.
All right. See. Another question comes from Pamela. She says, I have had CLL since 2006 with no treatment yet. My CLL has caused my IG levels to drop into the tank. What will the IVIG infusions they're talking about starting with my fatigue do with my fatigue? I have always been active, but I have days where I can't get much accomplished.
Yeah, that's a great question. So what I have seen on the days that my patient have to get their IVIG infusions, that day they end up having a low energy day, but the subsequent days in between infusions end up being high energy days. And so it can often help people reduce the amount of days that they are low energy and have that fatigue. Just knowing that that infusion day might be a little bit rough. I hope that answers your question.
And then we have another one. Is there an exercise / stretching movement you'd recommend we can do sitting down or lying in bed that can help us?
Oh, yeah, that's a great question. We'll go over a few. I'm so glad. Who asked that? I can't see it on mine.
That one was a private message
Oh,
on
very
that
nice.
one.
That's okay. You don't have to tell me. Well, that's always a really great one. So as far as stretches laying down, some of my favorite ones just to get started are knee to chest. So that's just bringing one knee up to your chest or both knees up to your chest, holding it with your arms. What it's really nice at doing is like kind of opening up the vertebra in your back and just stretching the back of your muscles in your leg and then just bringing it down. You might start with that. I like to start with one leg at a time with my patients and myself, see how I feel, and then move on from there. I love these ones called windshield wipers, where you bend your legs laying down in bed and you windshield wipe your knees back and forth. With that, kind of helps open up the disc space in your back, get a little stretch in that low back, and get moving a little bit. Those are more stretching exercises, but if you're looking for like strengthening exercises, some really great ones are ankle pumps, just moving your ankles back and forth in the bed laying down. You could also do those sitting. That is really nice for blood flow. It gets your blood moving throughout your body. You could do leg raises, where you just do like a straight leg raise up in the bed, lifting your leg up and down slowly. Start with 1 or 2, see how it feels, and then build up to 10. And then you can take those knee to chest laying down and just use them as like kind of a leg press, or pretending like you're pushing something away, like maybe your footboard of your bed. And that can actually work on the leg muscles too. For arms, I think just like doing a really big like arm stretch first thing in the morning can be very nice. And you can just do like a full body stretch. But for arm exercises, even just like pretending you have weights and punching the ceiling, it's kind of like a reverse push up, but you're just doing it laying down. And that's really nice movement that you could do laying in your bed. Even just bicep curls without the weights, just bending your elbows. And then same thing with your wrists. Ankle pumps for your wrists. And then seated exercises. I really like doing like stand-ups and sit-downs, just because you need to do that in your everyday life. Seated marching is really great. And then seated kickouts. And then those same exercises that we went over for your arms, where you're doing like a press up or those like bicep curls, you can do sitting, but maybe start to do it with like a soup can, or I don't know, your favorite piece of clothing, something that's a little bit heavier than nothing. So those are all really good options.
I really like the way that you describe the difference between physical activity and exercise. I think it's so easy for people to get lost in, I need to be exercising in order to like benefit my health. When in
Yeah.
reality, just getting up and moving can do so much for a person and is really one of the better ways to help combat fatigue and just overall make people feel better. So I think you did
Yeah.
a great job of highlighting that.
Yeah, we find that people who like go to the gym and do like a really vigorous 30-minute workout, but then go home and lay for the whole day, don't get as much benefit as like maybe the grandma that has her like her starter garden or like just her hobby garden and kind of slowly works at it throughout the day. Like she ends up expending more energy that way than doing one big bout of exercise, as we like to think about it. And I really like the like tortoise and the hare example for that reason, where it's like slow and steady really can win the race with this. So you can do a lot more throughout the day.
Right. I did have a question of, so you mentioned when you have your bank account and you have
Yeah.
to budget for things. What happens when you overdraft on that bank account? What happens when you have a week where you have your grandkids' birthday party,
Yeah.
but you've agreed to go meet up with your friend who's in town for the first time in 30 years? Like, life happens, things are going to be busy.
Yeah.
Are there ways that you can kind of help manage that, or what's the best kind of road to recovery when it's you've overdrawn yourself and you don't have anything left to give, but you can't turn down some of these things? Are there
Yeah.
tips to help recovering?
Yeah, I think a good night's rest, so you actually replenish your bank account as much as you can. That's kind of like your daily battery reset or bank account reset. So even if you don't get back to your full amount of your bank account, if you get a good night's sleep, you might get a quarter of it and then still be able to meet with that friend for lunch. I think also like calendaring is really important. So you might look at your calendar and start to put like red for like your high energy expenditure tasks, and make sure that you schedule some like yellow or green days following that. Kind of a built-in rest day, because while you might have like a really fun busy week, that probably won't be sustainable and you probably need to schedule some recovery time. And on those days why we don't want you to sleep maybe for the whole day, maybe you have a little bit more time for naps or home things that you need to do, home projects like laundry, or like making sure you go to the grocery store, but not doing all of those things in the same day, but being like, okay, I need like 3 yellow days so I can go to the grocery store one of those days. The next day I can do my laundry, and the next day I can take a really nice shower, because I just had 5 red days in a row and I just feel drained. And so that's where being honest with yourself about what you can handle is really important. And then also setting boundaries with the people that we love. So, like, if your friend can maybe not meet the day after your grandkids' really busy birthday party, but can meet like a few days after just so you can recover. I think a lot of people in our lives can appreciate when we are like, hey, I really want to see you, but I'm wondering if we could do it maybe like 2 days later instead of one. So those kind of scheduling things can go a long way, and boundaries can go a long way too.
All right. Does anyone else have any other questions? Now is the time to ask those. Susan says, I like the grandma example of moving about all day. The busy weeks can be thought of that way. So,
Yeah. Yeah. Just taking
yeah.
off little bits at a time.
Yeah. All right. It looks like our questions are coming to an end here, so we'll go ahead and start to wrap up. Thank you again, Allie. This was a great presentation, and it's always such a pleasure to speak with you. So thank you for taking your time.
Yeah. Thank you
Um,
for having me.
Absolutely. So before we go, I wanted to highlight the Track My Disease feature in HealthTree Care Hub. Once you've connected your medical records to Care Hub, the Track My Disease feature provides you with the ability to gain a one-of-a-kind access to your health information. This will encompass lab results, genetic profiles, treatment histories, and all of this will help offer you invaluable insights into your own medical journey. On the screen, I have the link to sign up for HealthTree Care Hub, along with the email of our amazing patient navigators who are available to help you create an account and connect your records. I'll also include some information about enrolling in Care Hub and the follow-up email, so look out for that. Before we're done, I want to highlight we have 3 upcoming webinars. We will be meeting on Tuesday, September 17th with Dr. Ryan Jacobs. He'll be covering some current CLL clinical trials. Then on Monday, September 30th, we're going to have a meeting with all blood cancers that we sponsor here at HealthTree. This will be focusing on innovation in blood cancer. And then on Tuesday, October 1st, so those ones are back-to-back days, we'll have another all blood cancer meeting. This one's a pretty important one. It'll be highlighting some of the upcoming changes to Medicare for 2025. And then before you leave today, we do have that survey. I ask you kindly if you could fill that out. I'm new here at HealthTree, and I really want to make this CLL community meaningful for you. And I want to host events that are worthwhile for you attending. So if you would just fill that out, it takes about 2 to 3 minutes. It gets me the information that I need to give you the content that you deserve. So if you would do that, I would greatly appreciate it. And with that, I've attached my email on the screen here. Feel free to email me with any questions or feedback. I appreciate each and every one of you, and I hope that you have a great rest of your day. So thank you.